Hello class, how we doing today? This is Randy Winchester, and today I'm going to be presenting an article on protein synthesis and the amino acid leucine and its effect in older adults. So, the name of the article is Leucine Supplementation Chronically Improves Muscle Protein Synthesis in Older Adults Consuming the Recommended Daily Allowance for Protein. This is presented by Casperson et al., and this article was published in 2012. First, going off the strength of the research of the article, the grade that I would give this article would be grade 1, making it a strong source of evidence based on the setup of the clinical trial, and the quality and consistency will also be considered a grade 1. I based that off the few things, but this was a strong clinical trial. They had a stringent inclusion and exclusion criteria, and they also combined food logs with blood work and muscle biopsies to get their data. And all the body fat analysis was done with the most complex scan that you could use, which is a DEXA. The quality would be a grade 2. There were only 8 participants, so this limited the sample size. If you want more robust data, you want a larger sample size, but this article only had 8 participants, so I'm going to give that a grade 2. The clinical impact and general liability would be a grade 1, and from there I'm going to branch off and start going into the purpose of the study. So the purpose of this study, presented by Casperson et al., was to determine whether the increase in protein synthesis following a small low protein and carbohydrate meal would chronically increase muscle protein synthesis over 2 weeks with the low volume leucine supplementation in healthy adults. These are older adults living in usually a community setting, generally in their 60s and 70s. That was the target for this. Article. All of the adults were consuming the recommended daily allowance of protein, which is 0.8 grams. But we're going to be adding a leucine supplementation with that 0.8 grams, and that's what the researchers did in this study. They hypothesized that leucine supplementation would improve the mixed muscle protein synthesis by stimulating the mTOR signaling pathway and increasing muscle protein synthesis via more efficient use of meal-derived amino acids. So they basically want to get more out of these amino acids that are being consumed in the meals. Some things I just want to go into. So first of all, leucine has been studied extensively over the past decade, maybe over the past 20 years, on its effects on muscle protein synthesis. This article was significant because in the majority of the studies, you have the researchers examining the effects of leucine on athletes, because those are generally the ones that are trying to build the most lean muscle as possible to improve their performance. But this article focused on older adults in their 60s and 70s, and you know that the older adults, they are less active, they suffer more from muscle atrophy, so it's more important that we help them build lean muscle over time. Based on some research by Casperson et al., it is generally accepted that the aging is associated with a blunted protein synthetic response to meals containing less than 15 to 20 grams of protein per meal. So if the subject is getting only 15 to 20 grams of protein per meal, that's not significant enough to stimulate protein synthesis. Let's see. So while this deficiency may be partially or wholly overcome by simply increasing protein intake, there are a few obstacles, which is energy consumption, palatability, the cost, and the taste, and basic practices based on the adults study. So generally, compliance with excess protein intake, a lot of it has to do with a fear of increased weight gain because they're not being as active and they're consuming more protein. So the best thing to do would be able to accompany the excess protein consumption with some type of strength training program. We also have to deal with cost and taste. So those are kind of personal issues, but there are still factors that influence protein intake in all adults basically. Generally, compliance with protein intake is associated with energy exertion and consumption. If someone is exercising less, therefore burning less calories, they might be hesitant to consume large amounts of protein due to fear of excessive weight gain. So it's always a good idea to combine increased protein intake with the resistance training program. However, in practice, there's a risk that acute responses will not translate into positive chronic adaptations in lean muscle mass or functions. The reasons of a lack of success are varied, but we suspect they more reflect compliance-related issues and consumer choice rather than diminished physiological capacity. With this information, we propose that an effective supplement produce a robust anabolic response to the low-volume introduction of leucine into the diet. From a practical and mechanics perspective, the branched-chain amino acid leucine is an attractive supplement. Leucine has many well-described benefits on the regulatory mechanisms, controlling translation, initiation, and protein muscle synthesis. Nevertheless, aging muscle appears to be less responsive to stimulatory effects of normal, typical post-prandial concentrations of leucine. According to Casperson et al., several studies in both animals and humans suggest that increasing the leucine content of regular mixed nutrient meals may normalize or even increase protein synthesis in older populations. Specifically, Ryu et al. Reported that following a mixed meal, muscle protein synthesis in older rat population was blunted compared to younger rats. However, the addition of supplemental leucine to the meal restored normalized protein synthesis in the older animals. In a follow-up study where they used humans and adults ranged from about 70 to 71 years old, muscle protein synthesis was acutely increased in response to a leucine supplement meal. Of note, however, is in fact that 4 days preceding the metabolic study, the users had consumed a controlled diet of 0.8 programs protein per kilogram per day. All right, so for this study, there were 8 sedentary older adults who participated in this project. The study was approved by the Texas Medical Branch Board. Everybody received an informed consent and signed it. The volunteers were screened by the Medical Branch Institute, and the inclusion criteria included habitual protein intake, assessed over a 3-day dietary recall questionnaire, and they also had to be near the RDA for protein from 0.7 to 0.8 grams. Exclusion criteria included a history of regular physical exercise or training up to 30 minutes 3 times a week, cardiac, liver, kidney, or autoimmune disease, hypo or hypercoagulation disorders, diabetes, cancer, uncontrolled hypertension, infectious disease, a high BMI over 30, recent history of anabolic steroid or corticosteroid use, and participation in a weight loss diet. All those things were exclusion criteria in this article. The subjects reported to the clinic every day at the same time where they were studied. Their lean mass was gathered using a DEXA. They had blood drawn. They had biopsies done. They had catheter where they were given a DEXA scan. Catheters were placed in their arm to remove blood and analyze the blood in the lab. And the blood samples were obtained 2 to 3 hours after fasting, and every 20 minutes for the hour prior to following to the digestion of the simulated meal. The meal was a standardized beverage containing 7 grams of essential amino acids, 10 grams of carbohydrates. It was dissolved in 300 milliliters of diet soda, ingested at hour 4. The amino acid content of this meal was consistent with 80 to 90 grams a serving of most animal meats, so beef, chicken, fish. And while the digestion, absorption, kinetics of amino acids would certainly differ from protein-rich foods, this relatively small simulated meal has been previously shown to elicit only a modest anabolic response in older adults. According to Casperson et al., there was no change in lean mass during the 2-week intervention. Habitual protein consumption during the study period was 0.8 grams, approximately 62 grams per day. The recorded calorie intake was 18 to 1900 kilocalories. The data presented by Casperson et al. Suggests that leucine supplementation may be an energetically efficient and practical means of chronically improving muscle protein synthesis in response to a low protein meal in older adults who habitually consume close to the RDA of protein. The rationale for the use of dietary supplements should intake into account one or more of the following assumptions. Supplementation will improve net muscle protein anabolism above that afforded by the regular meals alone. The supplement will not negatively influence consumption of normally daily meals. The use of the supplement will not be compromised or restricted by lack of compliance. Complex preparation, high cost, and poor palatability. To this end, we demonstrated that supplementing regular daily meals with a relatively small amount of leucine improves both mixed muscle protein synthesis and anabolic signaling in older adults. Thanks. That's all I have on leucine in older adults. Thanks.